Difference between berberine and medication metformin. Hello guys, and welcome back to our channel. When we started to create this video, it was very noticeable that both berberine and metformin possess some powerful properties concerning diabetes management, anti-aging and longevity. Still, there are some key differences that may be surprising for you. Make sure to watch until the end to not miss any important facts. So if you suffer from diabetes or high blood pressure, you must be familiar with these drugs. But do you know how these drugs work? After watching this video, you'll know that and even more. So let's get started by looking into berberine first. Number 1. Berberine. Berberine is a Chinese herb that comes from the Coptis chinensis French herb, which has been used in traditional Chinese medicine to treat diabetes for over thousands of years. Berberine is a chemical with a bitter flavor and yellow hue. It may help strengthen the heartbeat, which could be advantageous for those with specific heart issues. It may also fight bacteria, control how the body utilizes blood sugar, and minimize swelling. People typically use berberine to treat diabetes, high cholesterol or other blood fats and high blood pressure. It is also used to treat burns, canker sores, liver illness, and other conditions. So what's the mode of action? The main mechanism berberine seems to work is making the enzyme adenosine monophosphate activated protein kinase, AMPK, more active. AMPK is a master regulator of cellular energy homeostasis and is involved in many biological processes, such as controlling glucose, lipid, and protein metabolism. Why is berberine prescribed? Diabetes, high blood pressure, and abnormally high levels of cholesterol or other lipids in the blood are the conditions for which berberine is most frequently prescribed to patients. Additionally, it is utilized in the treatment of burns, canker sores, liver illness, and a multitude of other conditions. Benefits of berberine. Number 1. Bacterial infection. Berberine might be an excellent way to kill bacteria and other germs. A laboratory study done in 2016 found that berberine helped stop Staphylococcus aureus from growing. Aureus can lead to some health problems, such as sepsis, pneumonia, and meningitis. Berberine is effective in preventing bacterial diseases. Number 2. Inflammation. Inflammation significantly contributes to numerous diseases, including heart disease and diabetes, and is a factor that leads to premature aging. Some 2014 study indicates that berberine has anti-inflammatory characteristics, suggesting that it could be used to treat diabetes and other illnesses associated with inflammation. Number 2. Metformin. Metformin, which is also sold under the brand name Glucophage, is the primary treatment for type 2 diabetes, especially in overweight people. It's also used to treat a condition called polycystic ovary syndrome. It is taken by mouth and is not linked to weight gain. So now you might ask, what is better to take? In a 2008 paper published in the journal Metabolism by a group of Chinese researchers, berberine was compared to metformin in patients with type 2 diabetes mellitus. Berberine was shown to have a similar effect on controlling hemoglobin A1c, which is the long-term blood glucose level, fasting and postprandial blood glucose levels as metformin. The authors concluded that berberine, like metformin, lowers insulin resistance. In this regard, both substances act on the AMPK system. Interestingly, both total and LDL cholesterol decreased with berberine, but not with metformin. Overall, the researchers showed that berberine was well tolerated and had no effect on liver function tests, thus did not burden them. Gastrointestinal side effects were observed, but less frequently than with metformin. It is the experience of physicians worldwide that berberine is well tolerated and probably has equal or even better efficacy than metformin. It lowers hemoglobin A1c in patients with prediabetes or early diabetes just as well, if not better, and has the added benefit of lowering cholesterol and having some anti-inflammatory and immune-boosting properties. Now what dose should you take, you ask? Well, the recommendation is a dose of 500 mg either at dinner or before bed, which can be escalated up to 500 mg each before breakfast, lunch and dinner depending on the desired effect. You should note, however, that since metformin is an established prescription drug, the study record is much better. We also have to give you one more hint. Before discontinuing, changing or supplementing your medication, you should always consult your treating physician. Combinations of anti-diabetic medications can sometimes carry a risk of hypoglycemia, a condition you definitely want to avoid. So, before you go, don't miss our other video about berberine, which you can see on the screen now. There's a lot more interesting information about this ingredient. We'll be back in the next video.